Do you take medicines? A medicines list can help anyone who takes medicines and those involved in their healthcare. It can allow better and faster decisions to be made about your medicines and reduce the chance of error. How do you use a medicines list? On your medicines list, fill in the name of each medicine you take, how much you take, and when you take it. Make sure you include all of your medicines, such as tablets, inhalers, injections, patches, eye drops, and creams. You should also include medicines you get in your pharmacy, such as vitamins, supplements, herbal medicines, alternative medicines. Include any allergies you have. Include the contact name and telephone numbers of your doctor and pharmacist. If you need help filling in your medicines list, ask family members, friends, or people who support you. You can also ask your pharmacist or GP to print out a list of your medicines. Remember, keep a copy for yourself to keep track of your medicines. Keep it where you can easily find it in an emergency. Keep a photo of it on your phone. Bring it with you to any healthcare appointment. Bring it with you when requesting repeat prescriptions. Share it with family and friends, your doctor or consultant, your pharmacist, dentist, or nurse. Your healthcare team may not have this information. Health records don't currently link up. For more information and to get a free copy of a list, visit www.hse.ie/safermeds.